So Dr. Chin just finished Sarah's right eye, having her LASIK, so non-cutting LASIK with extreme prescription like Mana 13, which is actually like 5 times legally blind. That big E that we normally see on the exam rooms to check your vision. It has to be 5 times for her to be able to see it. We're in Park 25th Street and Park Avenue South. We're in the ground floor. We're actually the only glass OR in the whole East Coast. Actually, people walking on the street can watch a live surgery and see how safe our safe side non-cutting technique is. We have a seminar once a month, so they are invited to come and watch a live surgery. Now Dr. Ching is going to be doing Sarah's left eye. So Sarah has a very, very bad prescription. We're talking about a 13 and a quarter. For those of you who don't know, on a 3.50, that's legally blind. So Sarah is having LASIK, mitomycin C, extreme prescription OS, Resilo 380, pupil size 5.9 just to 8.5, 4% normal ground adjustment, total correction minus 13.25, minus 0.25 at 180. Dr. Ching specializes on these cases with high prescription, thin corneas, or actually extreme prescription, thin corneas. And the reason why he is able to do this extreme prescription because he has to switch completely to these non-cutting techniques, which are also called tissue sparing techniques, where the cornea that is cut in the flap on the center is a waste of tissue that can be used to treat some of that prescription. You don't have to leave the prescription, some of the prescription left in your eyes. So Mana 13 and a half, that's an extreme prescription.
Yeah, that's great.
But the chin needs to remove the epithelium or the skin of the eye. That's the first step to access the cornea. It's a completely painless step. And he does that very smoothly, just removing it, making sure there are no debris in the area before the laser portion starts. This is a variation of the LASIK Dr. Chin helped develop when he was doing his residency fellowship, his residency training at Harvard with Dr. Talamo. And he actually called it safe side. The reason for that is a variation of that LASIK with a quicker recovery, completely get rid of that discomfort pain that was present in that LASIK. Shadows detected with Star Tracker. The laser we use is ready. It's a VisiPlex 4AR. It's the only laser that can deliver high definition custom use treatment. So the Chin performs about 2,000 eyes a year, which is 1,000 patients. High volume surgeon. We only use MD during your preparatory evaluation. Sarah has her whole family here, into her company. Dad, brother, for support, and mom is here in the waiting room. As I said, we have the last hour, so mom is here in the waiting room. I'm a little bit nervous because of the decision of her daughter. She's waving hello. She's doing very good, very steady. We only have like 30 seconds more to go. On average, takes about 10 seconds per diopter. If you're Mana 3, we're talking about half a minute. On her case, we're talking about a minute and a half because we're talking that precision is minus 14, minus 13 and a half.
10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1, and that's it.
Mitomycin C? No talking, Sarah. Dr. Ching is going to use that medication called mitomycin C. It's a medication used to prevent the formation of a scar. It's used on prescription about -5. Dr. Ching uses this medication the most, more than all the other refractive surgeons in New York combined. The reason is because by default, he's treating all the highest prescription patients that were rejected before for that cutting technique, the LASIK or the bladeless LASIK. If you are a LASIK patient who have a high prescription and you were rejected in the past, chances are that you might be a good candidate for safe side. Please feel free to call us or visit our webpage at www.parkavenuelasec.com to find out more. Then the thing is rinsing that solution, that mitomycin C, and then you're gonna place a bandage contact lens. It's a contact lens with no prescription. Sarah is gonna hold in her eye for just a few days for a long weekend. It's a clear contact lens with no prescription. So every time you're blinking, or every time Sarah is blinking, she's not rubbing that newly formed surface with her eyelids. Antibiotic to prevent infection. And then the team is going to use another drop of, they already used another drop of steroid. So the surgery is done.
Slowly close your eyes.
Sarah was not able to read what it says here in the track. Those big letters. And brother is waving hello.
Your eyes closed, sit up with your eyes closed.
Keep eyes closed, Sarah.
Okay, so how you feeling, okay?
Yeah, that's the second eye I felt the speculum.
Yeah, I think everyone always says the second eye is more uncomfortable.
Yeah. I really struggled to find that red dot on this eye. I think it had something to do with the patch on this eye or something.
Yeah, everyone finds the second eye harder, but
Yeah.
it is fine. Someone did a study maybe a year ago where they published the result and somebody found that everybody finds the second eye harder.
Oh, okay. Well, that's good to know.
You know what? I think you're trying to close the first eye, or it's a little sensitive because you just had a dot. So.
Maybe, yeah.
But you did really well, especially for long prescriptions. So.
Thanks.
That's awesome.
Yeah, you must have been very studious because normally myopia is associated with reading.
Yeah.
Oh, yeah, no,
Are you a big reader?
yes.
Yeah, I was a big reader too, so I got pretty nearsighted. So it's like a combination of genetics and
Yeah,
stuff.
I read a lot and studied a lot.
Yeah.
I actually went to Columbia.
Oh, really? For what?
I'm pre-med, but I studied anthropology and women's studies
Oh, okay.
too.
So what were you in your pre-med thing?
So I'm going to be taking my MCAT soon and go back to med school. I took a couple of years off to work.
Oh, wow. What'd you do?
What am I doing now?
Yeah.
I work for a nonprofit.
Oh, which one?
It's called Resource Generation. It's actually on 23rd and like 3rd.
Oh, really?
Yeah, it's around the
What do they do?
So they work with 18 to 35-year-olds to identify as wealthy and want to use their wealth for social change.
Oh, you told me that.
Yeah.
That's interesting.
Yeah,
so these
it's
are kind
really
of like
cool.
trust fund kids or whatever.
Basically, they're trust
Yeah.
fund babies who are like, we don't deserve this money, we want to give it away.
Oh, that's pretty good.
Yeah, it's awesome.
Yeah, so that means like they're nice, altruistic, younger people.
Exactly, yeah. It's
That's
awesome. Yeah.
Hey, I have this weird doctor who works here who wants to marry a rich wife.
So I should hook him up with someone.
Yeah,
Yeah, there we go. Spread the word. Spread the word.
No, you did very well. You had a whacked out prescription, okay? So
Yeah.
your prescription's way past what could be treated with any of the cutting procedures.
Right,
LASIK,
totally.
Intralasers.
That's why I've given up until I found this.
How'd you find this out? Because we're not doing a great job of getting the word out, by the way.
Well, so I actually, I don't know if you can see it, but I have a chalazion on this
Oh.
eye. And so I originally was going to come in to get like the chalazion treated. Right.
Yeah.
Thank you. But then yeah, I ended up just going somewhere else because you were traveling at that
Oh,
time.
yeah.
And then the lady was like, well, would you be interested in like laser eye? Because she's like, we won't treat the chalazion unless like you're interested in laser eye surgery. And I was like, actually,
Oh, that's weird.
I am.
Yeah, interesting.
Yeah, so I came across it very like randomly, but
Yeah.
you know, things happen for a reason.
Yeah, that's good.
Yeah.
I guess, yeah, we should try to get the word out there. So, you have a question or anything about it?
Hmm?
Okay, so what's the main reason you want to do this is you want to stop walking into things because it's so bad.
Yeah.
Like basic things you
Yeah, I
couldn't
don't think
do.
people really realize when it's 12, when it's 13, you could only see maybe a foot in front of your face.
Right, and
Yeah.
even that is blurry.
Yeah. No, and once you pass -10, you can't even read that grade without your glasses.
Right.
You can only see like one word at a time. You
Right.
can't really scan.
And it has to be like,
It's so close to reading one word at a time, so
Right.
it slows down your reading speed.
totally.
You know, so people don't realize that.
No, totally.
It's a real handicap. So.
Yeah, yes, it is.
When did you start wearing glasses? When you're really young?
When I was in first grade.
Yeah, I started when I was 3rd grade. So, okay, so this is the worst you're going to see for the rest of your life. It's not the best. You'll probably get your best vision in like 3 months.
Okay.
So you'll be legal to drive today, actually, but you don't want to drive.
Right.
And you'll be like glasses or contacts in about a week to 10 days. Normally it's like 3 to 5 days, but because your prescription was so bad, you won't see like glasses or contacts for like 7 to 10 days. And then you have a chance of maybe like, we did this study that was published a year ago that I presented in Milan. Everybody more than -9, and they all saw better after our surgery than they did in glasses or contacts. Because we're getting rid of minification. When you wear glasses or contacts in a high prescription, the image is sharper but smaller. You might have noticed that when you put in the glasses, it's like sharp and small.
Yeah.
So we'll make it sharp on the cornea but big. So the relative magnification makes them see better.
That's awesome.
Yeah, it's really interesting. Okay,
Wow.
so just stand a little bit to the side so we can see what she's saying. And then I guess before you started, you couldn't even see the big red name of the truck, I don't think, right?
No.
So it's just like the maybe a truck. Okay, so you ready to open your eyes and be amazed? You open your eyes. Hey, check it out. Is that crazy? That's the worst you're gonna see the rest of your life. It's crazy, right? Everybody cries. So whenever it's crazy, right? Whenever we do everybody over 10, they're like, it's crazy.
Oh my god.
Don't cry in the contact. So this is the worst you're gonna see for the rest of your life. Everything's gonna be sharper, 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 sharper. It's sick, right? Yeah.
That's awesome.
Yeah, most people are like, oh, I'll take this.
Wow.
Yeah,
That's
so
great.
Cool. Yeah.
That's great.
Yeah, this is what we live for.
Awesome.
Yeah, you did great.
You did great.
Yeah, nice and patient.
Yeah,
So sorry
I
to
have seen
calibrate the
her
laser.
all the
That's
time
it.
in the
That's it.
classes.
It's better
She
than a
loves
non-
like
Yeah, it's better than a non-college.
she
No,
was
this
like,
is
first
great.
grader,
It's
she was
crazy,
like,
right?
I
I
can
know.
see what it says.
You haven't
Yep.
seen like this since you were like kindergarten.
Probably before that.
Insane, right?
Yeah, that's great.
Check it out. You're -12. We lasered somebody -22.
I'm.
It's about 13, yeah.
I thought it was -14.
Yeah, -13. So yeah.
yeah,
You did
that's
great.
You want to
good.
have a
Good
friend on
job.
YouTube?
You see Dad for the first time.
That's that.
You see Dad? You can see. Can you see that? Can you see that?
Yeah, I can.
That's mom. That's mom sitting there.
Congratulations.
Thank you.
Good.
You're awesome.
Yay.
Thank you,
A+,
doctor.
okay?
Yes.
Good job.
Thank you.